So we're going to talk about toddlers. It's chapter 11 in the 10th edition of the Wand book. And it is not quite my favorite age group, but they're pretty darn cute. I like when they're 4 and they pee and poop on their own. That's my big, requirement. All right, so most of the time, people relate this age group to the terrible twos, right? Toddlers are considered ages 1 to 3 years, so 12 to 36 months. And pretty much they're trying to figure out how things work and figure out their independence. So that's why temper tantrums happen, because either their parents won't let them or they're not physiologically capable of completing the task that they're trying to complete. So they get frustrated, and when they get frustrated, they throw a tantrum because their communication skills are still developing. And they can't really control their emotions. They can't really say, I'm frustrated. They just scream and yell. So that's why we see a lot of tantrums. We see a lot of no and negativism here because you'll see 1 to 3 year olds, you'll hear it all the time. For those who have kids, you've heard your child probably say, no, I do it. No, I do it. I do it. Because again, it is this intense period for them of learning how to be independent and learning how things work. And when we do it for them, they get frustrated. So that's where we're going to see a lot of this. We're going to talk about routines. Routines are crucial for this age group because when they know what to expect and they have everything's the same all the time, then they're able to do it, right? Because they know what to expect and it's made capable for them. So routines are going to be very important. It's really going to be important to help parents remember that we have to focus on their positive behavior and really ignore the negative behavior, which is almost impossible when you have a child screaming at you. But it's really important because they're getting attention. And kids like attention, and it doesn't matter if that attention is negative or positive. If they're getting attention, if they do something and you react, you've given them attention. So if you're screaming back at them, they've gotten what they've wanted, some kind of reaction. So we got to really focus on that positive behavior. Biological development. Basically, remember we talked about infants and they have this linear growth and that nice, pretty, growth chart. Toddlers are totally different. They are very step-like. They have these huge growth spurts. So they gain about 4 to 6 pounds a year, but they come in spurts, and their height is about 3 inches a year. And what's really cool is that you can pretty much predict their adult height by knowing their height at 2 years, because their height at 2 years, you times that by 2.5, and that's their predicted adult height. There are other biological, this is when that anterior fontanelle closes. So that should close by 18 months of age. If it is still open after 18 months of age, that's a red flag. We refer them to a neurologist to get looked at because the brain has already done its growing, developing. It now needs to be protected by the skull. So if it hasn't closed by that period, we want to make sure that it does get taken care of. Sensory development. As you can see along the way, their visual acuity gets better. Toddlers have amazing hearing. That's why it doesn't matter if you're talking about them 3 rooms over. They'll be like, what'd you say about me cleaning my room? Right? They can hear you, okay? So on that same token, they're really sensitive to loud noises. So if they go to fireworks shows or loud concerts like they should not be going to, they're really sensitive to those loud noises because they just have really good hearing. With taste, what they're doing is they basically explore things through their senses. So they explore it by seeing it and touching it, looking at the color and the texture. So they're not likely to taste new things or try new things because we're going to talk about it in a little bit. They don't have logical thinking. And so as they're using their senses to explore the world, they really can only use their knowledge of things. And so if their knowledge of foods that are green are broccoli and green beans, and I don't like broccoli and green beans, then all foods that are green I'm not going to like, because that is their way of perceiving. So they use their senses to kind of figure out, or like, I got hurt, and when I got hurt with a red crown, like that'd be ridiculous, but a red toy, then all red toys are dangerous. They are making connections, but those connections aren't always logical, and they're making those connections by the things they experience, and they're experiencing things through their senses a lot. Basically, all their physiological systems are maturing, all right? Everything's developing really good. The big thing for them is their eustachian tubes, their inner ears, are completely horizontal. So as adults, and as they start to grow, they become more at a diagonal. And that's why when we get colds or get stuffed up, fluid drains down the back of our throat, and we don't really ever get ear infections. We might feel fullness or a little, off balance, but that fluid doesn't really sit there, it drains. So, but with kids, it sits there, and whenever there's a nice, I hate this word, moist environment, that's where bacteria love to grow. So that's why kids get a lot of ear infections, because it's easy for them to have fluid just kind of sit there and get infected. And they're also, because their tonsils are so large and because of the short ear tubes that are horizontal, they're just at risk for upper respiratory infections and tonsillitis. So that's why the kids always seem kind of snotty at this age. They start developing sphincter control at about 18 to 24 months. So about a year and a half, 2 years, they can start. We're going to talk more about this in potty training. And it kind of fits along with their development. This is one of their biggest developmental tasks in this age, is to learn how to potty train. And then sleeping improves. They can start to sleep more like an adult, sleeping through the night several hours at a time. They're typically still have respirations in their abdomen, though, so you still kind of have to count respirations in the abdomen. But otherwise, everything else is improving. Immune system's improving, digestion is improving. They're just maturing. Gross motor, they start to walk at about 12 months, and they start to run at about 18 months. All right, but their stance, they look like, oh my God, I'm trying to blank. Almost like the marshmallow from like Ghostbusters. Like they just run like this with their arms out and their legs wide. They don't have the greatest stance, but they start to run, and they fall a lot when they run, and that's okay. They start climbing stairs by the age of 2. And they can jump with 2 feet by the time they're 2.5. Their fine motor skills, like hands, they, by 12 months they can grab that object, and by 18 months they can throw it overhead without falling down. And then by the time they're 3, they can draw circles. And these are big deals for them. They're really excited when they accomplish this. All right, now we're going to talk about your theorist. Woo! All right, so Piaget, what is Piaget? Oh, and I'm sorry, this is Erikson. Erikson, what is Erikson all about? Psychosocial, right? That's okay. Psychosocial. So whenever we think Erikson, we think the social aspects of things, all right? So when Erikson's first stage, which is trust versus mistrust, lasts up until about 18 months. So that's why that stranger anxiety and the object permanence that we kind of were developing, it lasts up until about that 18-month age. And then we get into the autonomy versus shame and doubt. So they're basically figuring out, the big question is, what are the things I can do for myself, or do I have to rely on others to help me? So remember, when they were an infant, they relied really heavily, they were very dependent on others to provide care and safety for them, right? That's what helped gain their trust, is that I verbalize I'm upset, someone helps, meets my demands. Now we're moving on. No longer do they want someone else to meet their demands and needs. They want to figure it out. They have to develop a sense of control and some confidence to say, I can do these. I have confidence in my own abilities. If they don't develop some self-control or control over their, means to take care of themselves, and they don't develop confidence in their ability to accomplish small tasks, like just getting dressed, brushing my teeth, then that's when they develop shame and doubt. All right? This is why being negative is so popular in this age group, because they are trying to be autonomous. They are saying, I can do it. I can take care of me. And again, this is why rituals are so important, because when we provide them opportunities to succeed by rituals, we're helping increase that level of autonomy. If we set them up for failure, then they're going to develop shame and doubt, okay? If they want to get dressed on their own and physically they can't button a button, right? They can pull their pants up and down, but they can't button a button. If we buy them all clothes with buttons, we've set them up for failure, because they're going to get angry and mad that I can't button my pants. But if I get you a pair of pants that you can pull on, you can say, look, I did it, right? Being patient in this age group is really hard. Bless you, by the way.
Thank you.
They want to put their shoes on. Again, they don't really know how to tie laces, so if you buy them shoes that they have to tie laces and then you just do it for them, they're not gaining that autonomy, all right? And they're developing that shame and doubt. So, and they don't like to be rushed. They like to know what's coming. They want to be set up so that, okay, like, I know that after breakfast I put my plate in the sink or do whatever. When they have chores and rituals and they can follow it, they're super proud of themselves. They say, look, I did it. I'm in control. So that's why it's so important in this age group. They're very early to develop delayed gratification, but they don't know how to share yet. Okay? So, with an infant, I cry, feed me. We're at the beginnings of being able to say, I'm hungry, but I can wait a minute to be fed. I don't need to be fed right this instant to have my, needs met. It's the beginnings of it. All right. Then we move on from Erikson psychosocial to Piaget. All right. And remember, with Piaget's sensory-motor phase, that's the phase we learned about in infancy, because it started at 0, but it kind of crosses over into toddlerhood, because that sensor motor goes up until 2 years of age. And basically, the sensor motor phase is just what it says. They are coordinating their senses with their motor responses. Like we talked about with shaking a rattle. I went from just having reflexes to learning how to coordinate my movement to using my movement to explore my world. Okay? So they learn big time in this first sensor motor stage by watching and imitating. So this is why kids do great with dolls. Toddlers, if you show them and say, here's a doll and this is where the stethoscope goes on the doll, they can then take the stethoscope and put the stethoscope in the right spot on the doll. They're very good at watching you and imitating you in this age group. They like to carry out little experiments and see things. What happens if I mix red paint with yellow paint? What color do I get? That's fun for them. So you want to provide opportunities for them to try things out in a safe environment. Because toddlerhood goes from 2 to 4, toddlerhood starts at 1 to 3, Because it goes 1 to 3, we have the beginnings of, or the endings of Piaget's sensor motor and the beginnings of his next phase. So Piaget has 4 major stages. The first one being sensor motor, the second one being pre-operational. Within pre-operational, you have this first, there's section A and B basically. And within pre-operational, you have the pre-conceptual phase. And this goes 2 to 4. So Piaget, we kind of are coming out of the infancy sensor motor and we're starting into the pre-operational phase. And here, again, they start to develop more language and they're doing these little experiments and they're learning about their world, but they can only use their experiences to make decisions or influence what they think about the world. It's not like I can say, well, like for my son and daughter, if my son did not like green vegetables, I couldn't say, well, Ray likes green vegetables. He doesn't see it from her point of view. They are not there yet cognitively, okay? They can only see things from their point of view, and their point of view is based on the experiences they've had. So the more experiences they have and the more things you expose them to, the more they're able to kind of understand their world. But they don't logically think, right? They think that if I go by a desk and I bump my leg and I get a scratch, all desks will give me a scratch. So you can see where they're starting to line things up. It just doesn't make sense. In their mind, it makes sense. So I've had a toddler come up to me and be like, oh, well, I've been wearing a Band-Aid. Oh, you must have gotten a shot. No, I just have a cut. Because in their mind, the only time I wear Band-Aids is when I get shots at the doctor's office. So do you see how so sometimes you look at a toddler like, where did you just get that from? Because it makes absolutely no sense to you. But to them, it makes perfect sense because they're using their experiences in the world to, kind of tell them how things go. All right, so Piaget, we're at the end of the sensor motor. We're at the beginning of the pre-operational, which is the preconceptual part of the phase. They ask why a lot, too, in this age group. If you've ever been around a 3 or 4-year-old, the why question will drive you bonkers. It is like, why are you wearing a blue dress? Because it was in my closet. Why is it in your closet? Because why'd you buy it? Because I thought it was cute. Well, why'd you think it was cute? Because I like the little paw prints. Well, why do you like paw prints? Because I like animals. Why do you like animals? And you're like, for the love of Jesus, please stop asking me why. But again, they're just trying to figure out, their world, and they want to know why. So they're not meaning it to be incredibly annoying, but it is. So, spiritual development, it's basically based or parallels their cognitive development. They don't really know why a lot, which is why they're asking it all the time. But they do like rituals. So they feel very comforted by any type of ritual. Whether it's, I say prayers every night, I read my devotions, we pray on, I'm blanking right now, but whatever it is that the people do, whether it's religious, spiritual, whatever, if it is a routine for them, they feel safe and secure. They like it. Again, they have no idea why they do these rituals. They just feel secure in knowing that that's what's happening. They continue to develop their body image. The big thing is, and it parallels their cognitive development. So they're starting to see connections. They're starting to see, how things work. But there's not a lot of logic there. And it's really, really important that you refer to things by the name. It is a vagina. It is not a hoo-hoo or a pocketbook or a vajayjay, or I could tell you 400 other words I've heard, some crazy things. It is a penis. It is not. My son likes to call us. One time I almost fell over. I had to keep such a straight face. He said something and he goes, "Oh, my snack pack." And I said, "Your snack pack?" And he goes, "Yeah, I got to protect my snack pack." And I was like, I'm thinking snacks because I wasn't right where he was. And I was like, "What are you talking about?" He goes, "It's my pretzel and my 2 grapes, or my 2 grapes and my pretzel stick." And I was like, "Who told you this? Like, we do not talk like that." And he's like, "I just made it up. It's pretty true, huh, Mom?" And I'm like, "No, it is your penis and testicles." He's like, "That's silly." I'm like, "Oh, but snack pack is not." All right. So it's really important that you refer to things by their names. I remember getting emails, when my daughter was in kindergarten, because she would use the word vagina like she would use the word thumb, because it was just we're very open in my house. And I would get the, "Dear Mrs. Daniels, can you please talk to your daughter about," because she would just be like, "Do you know this?" But that's important to do, all right? Don't refer to things like pocketbook, because remember, they don't have logical thinking. So if they see Mommy put a lipstick in her pocketbook, and they're going to try to put a thing of lipstick in their pocketbook, okay? And I have seen that. So if they see if Mommy says, "I keep my lipstick in my pocketbook purse," and then we call that same thing the vagina, then we've seen kids stick items into their vagina or into their bottom because parents use other terms, and kids get confused. And they're not logical. They're exploring their world right now, and they're imitating, right? We said that they imitate. So they want to imitate Mom, and they use that. So we have to be very just open and honest. If we don't make things a big deal, they won't. Because remember, follows their cognitive ability. Do they have the cognitive ability to think about sex at this age? No. So it is not ever sexual in nature at this age, so you don't have to worry about that. You're just teaching anatomy. That's it. All right? So by 2 years of age, they know, girls and boys. And then by 3, they know what it means to be a boy or a girl. Like, to be a boy, you have a penis. To be a girl, you have a vagina. All right? Gender identity is still a different issue. They say by 3 you have your gender identity, but I don't know. There's arguments on that, and they're still exploring and doing research on that. But as far as physiology goes, by 2 they know the differences between girl and boy, and then by 3 what it takes. Don't put negative labels on physical appearance. It's amazing how early kids are associating negative things and developing a sense of self. And I'm at total fault for it myself. I mean, my son was such a yummy, chunky baby. He is about this big now. He's a rail, okay? And he's got like an 8-pack, and he's incredibly fit. He does gymnastics. So, but when he was little, he would just eat and eat and eat and eat and eat. And this is horrible, but no judgment zone, right? I would sing to him, fat boy, what you gonna do? What you gonna do when there's no food for you?" Because he would just eat and eat and eat. And it didn't even, I'm a pediatric nurse practitioner. I lecture about this. I teach about it. And it was never meant as a negative thing. It was meant as my way to play with him and love him. And he would, when he said something one day, and he's like, "I don't like when you say that," or something, and it dawned on me, oh my God, he's taking it negative, and I don't mean it. He's got a ginormous head, we had it CAT scanned twice to rule out hydrocephalus. So he's just got a big head. And people would say things, and he's still to this day, he's like, "I know, me and my big head." I'm like, "You mean that awesome, wonderful head with lots of brains?" Because, he's sensitive about people saying it. So it really sticks with them super young. So we need to be careful that we don't do any negative labels associated with appearance. Sexuality, again, they are learning about the world, and they are experimenting but they don't know what sex is, all right? So don't get freaked out, but they will explore themselves at this age, all right? It is totally normal because it feels good, right? I mean, I don't want to know about all of you, but it's something that feels good. And so they're exploring and they touch and it feels good, and I want it to keep feeling good. It has no sexual connotation behind it at all. And if you make a big deal of it, it will be a big deal. But if you are matter of fact about it, then they will be matter of fact about it. I can remember, again, these are the stories I think my children would cringe. My daughter was 2, and we were sitting in the living room, and she was just laying on the floor, and we were watching TV, my husband and I, and she was exploring. And no big deal. And I just simply said, Ray, that's something that we do in our bedroom alone. Like, if you have any questions, let me know. If anything seems funny, let me know. But otherwise, that's something private. And she was like, okay, and she left. My husband, of course, was like, I can't believe you just gave her a burn. I'm like, no, it's fine. But it was kind of fun. These were the things that her kindergarten teacher would write home to me about. Because then she would go to school and tell all her friends that, but it is no big deal. I can remember, we talk about my son too, and we have a boy dog, and when the boy dog was happy one day, my son turned around at 4 and said to the boy dog, we do that in our bedroom, not in the living room. And because it was no big deal. And he just walked away like, whatever. So don't make it a big deal. They like to play house. So they see, mommy and mommy, or daddy and daddy, or mommy and daddy kissing. That's what they want to do. So they don't really know that's why there are some questions about when sexuality develops. But they don't really know sexuality per se. If you see 2 kids hugging or kissing, same sex or different sex, they're just, remember, imitating their world around them. They're exploring what that means. So it's not a big deal. Just talk to them. Be open and honest, and don't be freaked out about it. Okay? Social development. Basically, their big important thing that they develop socially is that they are separate from others, that there is separation, and that they're their own being. So, and they're learning how to express their own individual characteristics, that I'm an individual, and how does that fit in? A lot of times, the big thing as they develop that they're an individual is that they're separating from their parent, particularly the mom. So transitional objects are really important in this age. So as they're learning to get separate from others and be a separate individual, when we hospitalize them and their parents are forced to go home because they have other kids to take care of or they have to go to a job, that transition happens kind of faster than they're anticipating, right? So even things like going to preschool could be a little bit because they're learning to separate. They're kind of over that, they've developed object permanence really well. They're over stranger anxiety. They're not really afraid of strangers per se, but they're learning how to separate from someone. And when they have like a favorite stuffed animal or a blanket, that I have this blanket when I'm with my mom and I still have it when she's gone, so I know that I'm safe, that helps them transition a little better. Language, they talk a lot, all right? Their language is exploding. And oftentimes they understand language better than, first before they can actually speak it. So, you can see they're developing lots of words. They're using 2 to 3 word phrases. Sometimes they'll gesture first before they speak it because they're understanding it. Like, instead of like saying pick me up, they may do this first because they know that means pick me up. And they're understanding that I want to be picked up, but I haven't quite got all the words yet to tell you to pick me up. And reading really helps with this. And if studies have shown that TV watching decreases. So I know everyone says that watching, and I'm not judging here if you have a parent or if you are a parent. I know that there's lots of educational things on iPads and this and that. But honestly, they've done some studies and it shows that it actually hinders language development that the biggest thing to help with language development is reading to a child. The more you read to them, the better it is. And a lot of times it really doesn't matter what you're reading to them as long as you're reading to them. My kids were 1.5 and 0 when I was in my first semester of my doctorate program. So I graduated, they were 4 and 2, I think, or 4. They got read my thesis. They got read my med-surg book. They got read, whatever I could get my hands on school-wise because I had to kill 2 birds with 1 stone. So it doesn't really matter a lot of times what you're reading to them, just as long as you are reading to them. Personal social behavior, again, they're working on that autonomy, their skills of independence. So this is why we have the sudden mood swings, right? They're frustrated when they can't do something and they can't control their emotions. So instead of saying, I'm frustrated, I can't button my pants, they just scream their bloody head off, all right? And they can go from hot to cold to hot, like within a matter of seconds. So the skills are feeding, playing, dressing, undressing self. These are the things that we want to help them accomplish. That's why we set up rituals for them, set up areas that they can be successful here, positive feedback, positive reinforcement, redirecting them. Okay, I understand you're frustrated that every time you take your spoon and go to feed yourself, you dump it before it gets into your mouth. Let's try again and maybe hold it all just straight the whole time, But don't get mad or frustrated when they're mad or frustrated because, then that's when they develop that shame and doubt because I couldn't do it and now you're mad at me because I couldn't do it. Be careful about things on their clothes. Like, you don't want them to have a bunch of strings and buttons. It should be easy things that they can manipulate. And again, it's just ignoring bad behavior. Bless you. I can remember sitting in the Outback parking lot because my daughter was throwing a tantrum. And I said, I was like, okay, this is not acceptable behavior. And then this is what we want to do. And she was just throwing a fit. So I had to bring her out to the car because my husband was now getting our food that just got delivered to the table, boxed, so that we could go home for the evening and trying to get the check as she is losing her crap. So don't ever judge that parent with that kid throwing a fit in the middle of the restaurant because trust me, that parent does not want that to happen. So I remember strapping her in her car seat and sitting on the, curb. Like, I strapped her into her car seat, I rolled down the window, I had the car running, I was sitting right there, and I just sat on the outside, ignoring her behavior as everyone walked by going, oh my God. Yeah, totally judging. So, I can't believe that mom is doing that. Because, I didn't want to reinforce her negative behavior. It is hard. It's one of the hardest things you do as a parent is to, not get tempted to be angry back. Everybody slips up, but really try to focus on the positive. Remember, play is how they learn and grow. And so infants were more onlookers or solitary play. And as we move on, toddlers develop more parallel play. All right. So they play next to each other. One can have a doll, one can have blocks. It's not the same thing. They're just playing next to each other. There's little emphasis on gender stereotype toys. So just give them anything. It doesn't matter. Remember, they're exploring their world. They're doing little experiments. They're trying to figure things out. They like educational toys. They love to pretend read. My niece cracks me up all the time. She gets in my car and she will open up any book or any, my kids have composition books that they like to draw and color in. She'll open it up and she'll be like, Lily was in the car with Aunt Amanda and she will read a whole story that she's just made up. But they really like to learn how to turn the pages and play read. They love tactile things like Play-Doh, big crayons, finger painting, anything that they can get like mushy and get their hands in and kind of explore. But be careful still about the appropriate toys. Remember, they're still at an age where everything goes in the mouth, so be careful about anything that they can aspirate. And they tend to be egocentric, meaning that I could be playing with my dolls, and I see you playing with blocks, and I'm playing with my doll, and I'm like, oh, I want that block. And they're not, because remember, they are not thinking from another point of view. They're not being a-holes, they're not being jerks. They just don't see it from that point of view. They don't see that taking the toy would hurt that person's feelings. They're just thinking about themselves, and that toy looks fun, and I want to play with it. So there's where some frustration can also happen between kids when they play, because they're just learning and exploring, and they're only thinking about themselves, and they can sometimes hurt their friends' feelings. Coping with concerns, toilet training. The next slides will talk about toilet training more, but a lot of times it's a control thing, and we don't want to make it a control thing. And it's one of their biggest developmental tasks to learn during this age group. Siblings, remember that they start with toilet training, they start developing that sphincter control about 18 to 24 months. So don't try to force it earlier. Really, by the time they're 3, they should be potty trained. Girls tend to get potty trained before boys. But in general, diapers are so good nowadays of sucking urine and, stuff off their bottom that it doesn't feel bad when they poop their pants. So they just keep on playing. So diapers are just really good nowadays. Siblings, they get upset, with each other because they think that a sibling might be taking attention away from them. So it's really important that we do things like giving one-on-one time with each child so that they feel special, they still feel like they have that time with you. And there's lots of different things you can do. You can, once a month, you can have a mommy date and a daddy date. And then the next month, the children switch. And then every other month, they just get to have a date with one of their parents. Once a month is not super hard. And that date could be going to Chick-fil-A or just going to the park. It's just time alone with their parent. Toddlers really like to help care, right? They're imitating. They want to do what you guys do or what we do. So if there's something that a toddler can do, let them. If it's, can you get mommy the diapers and the wipes so that I can change the diaper? Let them help with that. Okay, here's the diaper. Go throw that away for me, because it makes them feel a part of it. And then also make sure you don't take things from a toddler because it's for the new baby. It is not, you have to move to a new room because your baby sister is coming to live in your nursery. It is, guess what? You get to move to a big girl room because you're a big girl. Has nothing to do with the little baby coming. It's all about you. All right? Because remember, toddlers are all about who? Themselves, right? So, regressing behavior. We've already talked about negativism, temper tantrums. Regressive behavior is sometimes when they are upset, they will, like if they have been potty trained and a new sibling comes home and they see the new sibling wearing diapers, all of a sudden they'll start having accidents and start saying, I need to wear a diaper, because they want that attention from you. So you might see some behaviors regress just because they're trying to get attention. Again, don't focus on that behavior, because when you focus on that behavior, they're getting what they want. For toilet training, basically to know that they're ready is that they have that sphincter control. Basically, are they aware that they're going? And some kids are hysterical. When they're going, because all of a sudden, like, they'll be playing, and they're like, yeah. And be like, are you pooping?
No.
Are you pooping? I need my diaper changed. And they'll go to the same corner of the house. They'll go to the same, bedroom. All of a sudden, they'll disappear because they know they're doing it. And it's like, and then they'll literally sit there and stare at you and like, no. And I'm like, it's okay. Let's go take care of it. So once they have that voluntary control and they're aware of it, they're ready. When they can stay dry for up to 2 hours, or especially if they're dry over their nap, or really if they're dry overnight, that's phenomenal. They can communicate the need, like, I have to go potty. All right. A lot of times they don't make it in time, but you're like, okay, let's go. Even if they've already gone in the diaper, still sit them on the toilet and say, okay, keep trying. And then sit there for a minute or so and make a big deal of it. It's okay that they didn't make it in time. You're encouraging them. You're being positive about the fact that they're recognizing they have to go, and I need to recognize a little bit sooner to get to the potty in time. All right. They like to please their parents. So they'll go because you're excited about it. Again, make sure that they have clothes that are easy to remove based on their fine motor skills. All right, because nothing's more frustrating than being super excited about using the potty and then I can't get my clothes off in time. Don't put them in a jumper that like requires them to unclick and get it off, and like they don't have that, they can't hold it that long. They'll start becoming curious about your toiletry, patterns. So don't be, it's not a big deal if they're like, can I watch you go potty? It's not creepy. They're not being weird. They're just curious about what you're doing in there and like, what is it that you do in there? And oh, okay, I can do that. Again, they're imitating you. And they start getting really impatient with having a dirty diaper. That's another sign. Although, like I said, today's diapers are so good. They don't really feel soiled, so they don't get as frustrated. Be patient with them. There's lots to be creative with them. It's exciting. No one would ever say toilet training is exciting, right? Except for in pediatrics. Nutrition. The big thing, remember there's step-like growth. So during times where they're at a plateau, they're not hungry. So it's not a big deal for them to go along, a couple days or a period of time with not a big appetite. They're not growing during that time. So, they don't have a big appetite. And then all of a sudden they have a growth spurt and they want to eat everything in sight. Toddlers won't eat like meals. They like to snack. They're grazers. So they'll just kind of walk by, grab a goldfish, go play. Walk by, grab a tomato, go play. Walk by, grab another goldfish, go play. They're never going to like really sit down and have a meal. That doesn't mean that you shouldn't encourage sitting down at a table, practicing that, becoming a ritual. But don't get, freaked out like, you have to eat all your food. There's starving people in Africa, right? Like, it's okay for a toddler to not finish their meal. They may not be hungry, and they just may need to snack kind of frequently. Like I said, they sleep starting 11 to 12 hours per day. They have an adult pattern by 3. Hallelujah, right? We really like that. Back to the milk, only 24 to 30 ounces of milk a day. If they drink too much milk is delicious. It is like ice cream to them. It is because they're drinking whole milk. From 1 to 2, they're drinking whole milk. They need that fat for brain development. But that fat is yummy, delicious, ice cold milk, all right? And they will suck it down because it tastes good. And then they get filled up from milk and they don't want to eat other foods. And they become iron deficient. So, again, where is NCLEX going to take this? It's going to say something like, a mom reports that her son is drinking like 8 glasses of milk a day. The nurse notes that the child's iron is 4, which is incredibly low, but, low. And, what would be the nurse's action? Okay, educate about decreasing milk intake. Do you see where we're going to start applying that information there? All right. Juice, as far as this, 1 cup of fruit per day, that doesn't mean like 1 cup of fruit juice, right? Fruit juice doesn't have the fiber that fruit has. When we eat something like a pear or an apple and we eat the skin, that's good fiber as well as all the other vitamins and minerals. So don't let fruit juice be substituted for fruit. Dental health, basically when they have teeth, we clean them. Just like we talked about in infancy. A lot of times we can just use a little washcloth, or they have those little toothbrushes that fit on your finger. And this is at an age group where I do it, right? I want to do it. So let them say, okay, you tickle your teeth first, and then mommy's going to tickle the teeth. Because are they going to necessarily do a great job? No. Do we want to discourage them? No, because then they're going to develop some shame and doubt, and then they're never going to want to brush their teeth. So it is a fine balance. We have to still help them, but we have to give them some autonomy to figure it out themselves. Say, oh, you did a really good job tickling the teeth in the front. You forgot to tickle them in the back like this. And then you try, all right? So that's kind of where you take it. They start doing dental exams at 3 years of age, although many dentists now have programs. Well, they'll bring them in as early as 18 months, and they just sit on the chair and go up and down, and they play with dolls just to get them comfortable with that dental environment so that they don't freak out when they come. Fluoride treatments, especially if they're drinking well water or bottled water, they don't have fluoride in them, so you need to substitute. Kind of already talked about that. Injury prevention, remember this is one of our biggest things about anticipatory guidance, is kind of knowing the developmental capabilities of the child so that we can prevent injuries. We're always going to talk about motor vehicle injuries because it's very common, and car seat safety. Basically, you have to be in a rear-facing car seat until they're 2 years of age. So if you have kids and they're older, it was probably 1 year a while ago, but they did increase about 8 or 9 years ago. They said 2 years and younger has to be rear-facing. And the car seats have improved because they changed that rule right when my son was about a year of age, and his feet were like jammed up in his face because the car seat, the way he was long. So now they have made them where the car seat can be appropriate so that the kids aren't uncomfortable. They can be front facing when they're 3, and they have to be in a booster seat until they're at least 8 years of age or 80 pounds. And they have to be taller than 4'9". So that's, 80. So my poor 12-and-a-half-year-old daughter just got out of her booster seat 2 months ago. My family was like joking with her that she was going to go to prom in her car seat because she was, so old in her car seat. But she's just tiny with her celiac disease. She's just petite. But unfortunately, it's basically because you have to have that car seat or the seatbelt, be able to cross the shoulder and across the hips, okay? Not the stomach, not the thighs, but across the hip bone. And the booster seat just puts them in the right spot. Now, cars are coming out with lots of cool gadgets. Like you can have the seatbelts that you adjust on the side. Have you seen them? Where you can adjust them. So pay attention to it. Educate your families about it because that might help, especially for any of you short adults out there, that may still need a booster seat because you're not 4'9". We've kind of already talked about that. Drowning, they can drown in as little as 2 inches of water, okay? They're top heavy, so they fall. Remember when they run, they have that wide stance and they don't have full control, so they fall over easy. And I have taken care of a baby who drowned in a bucket of mop water because the mom was mopping the floor. The phone rang. The baby crawled over, picked himself up. I think he was about 14 months. He picked himself up, fell over into the bucket, and drowned. Yep. And so the mom's like, I have done everything I can to be safe. She's like, I had pool things up. We had double locks. It's not always a pool that they drown in, okay? They can drown in toilets. They can drown, and it's scary. Like I said, the bucket of mop water, but it happens. And again, it happens to the best parents. So we educate and we remind them, not because we think we're dumb or that they're not whatever. It's because this stuff happens. So we want them to be safe. Burns are really common in toddlers because they're exploring and they reach for everything. And they reach for that pot over the stove and dump it on them. Or they reach for maybe somebody's cigarette and just grab it because they don't know it's going to be hot. So be very careful. And accidental poisonings happen because they're, again, exploring. So they look at everything, they touch everything, and they put everything in their mouth. And it's really important to never say that medicine is candy. All right? Don't ever say, do you want to, you have a headache or you have a tummy ache, here's some candy. Because then they're going to be like, oh, candy's delicious. Again, they don't have logical thinking. So you gave them candy, it tasted good. I want that whole bottle of candy. Now I've just taken a whole bottle of ibuprofen. All right? So be very clear with them about what it is. Falls, they fall down stairs, swings. So it's, again, they don't have a great stance. So making sure that families have things that protect stairs. We already talked about aspiration. They're putting everything in their mouth. They're at risk for choking. And pet safety. They're exploring. They will go up to any pet and be like, like, I love you, right? What is that, like, cartoon? It's like Bugs Bunny. It's like, I love you and squeeze you and hold you and love you and squeeze you. Does anyone know what I'm talking about? No, I'll have to YouTube it. I swear, someone knows what I'm talking about. With the little blonde girl in Looney Tunes, where she wants to squeeze and love, huh?
That's the little, not the actual little kids. That's the little.
No, it's part of the Looney Tunes.
No, I know.
Oh,
The
okay.
little baby.
Oh, okay. Yes.
The baby.
Yes. And so I always think of that when I think of toddlers, because that's what they want to do. They want to love them and squeeze them and hold them and touch them. And then that animal is eating, or that animal has their favorite toy, and the animal's like, "Rah!" right? And like attacks. And the kid's like, I was just loving you, and I was just wanting to pet you. So now, again, they don't have logical reasoning. They can't say that, well, this dog was just eating its, food. That's why it was angry. Now it thinks all dogs are, jerks, or all dogs are going to hurt me. Because again, they kind of use their perception of the world. So we have to teach them to be careful with pets, be careful when they're eating, be careful when they have toys, be careful if two dogs are playing together that you don't get in the midst of it, because you don't want to get injured. And that's pretty much it. You guys have any questions about